I'm Dr. Allison Hay from Forest Grove Veterinary Clinic, and today I'd like to help you better understand the topic of dog spaying and neutering.
Dr. Hay, what is the difference between spaying and neutering?
Spaying is when we remove a female dog's ovaries, and neutering is when we remove a male dog's testicles.
At what age should I spay or neuter my dog?
This is a really great question and one that is very common. And unfortunately, there's no one size fits all answer for this one. So traditionally, we used to say all dogs should be spayed or neutered at about 6 months of age to help make sure that they don't go through their first heat cycle for girls and to avoid unwanted male behavior like urine marking in boys. More and more information has come out showing that keeping them intact, so keeping them with their ovaries and testicles, might provide some specific joint health benefits as they're growing, and breed specific might help them further down the road. And so it really varies. For some of our tiny guys, like a teacup Yorkie, we're probably still going to say 6 months. But if you have a giant dog like a Great Dane, we might be saying closer to a year and a half, 2 years. It really depends on your pet and your personal preferences, but we can definitely help tailor a specific time for you and your dog here.
What are the health benefits of spaying and neutering my dog?
There are a lot of health benefits for spaying and neutering your dogs. The big one it would be for our female dogs, in that when we remove those ovaries, we remove their chance of having an infected uterus later in life. That's called a pyometra. It's a life-threatening condition that requires emergency surgery. And so by spaying them, we remove that risk entirely. The other big thing that we can help with is that the more heat cycles that your dog goes through as a girl, the higher her risk of mammary cancer when she's older. And so spaying her younger is going to help reduce that risk of mammary cancer later. For boys, there's a few less health specific benefits, but definitely behaviorally, we're going to avoid more of that roaming behavior of them going out to look for other ladies in the neighborhood. But also we're going to hopefully avoid unwanted behaviors like urine marking in the house.
Are there any reasons not to spay or neuter my dog?
The big reason why you would not want to spay or neuter your dog would be if you have plans to breed them in the future, because when we spay or neuter them, we're taking away their ability to have puppies. There are some other health reasons that we might not want to have your dog spayed or neutered. So if they had a really severe heart murmur, if they had really severe kidney disease or liver disease, those would be reasons that they would be a higher anesthesia risk. And so the risks might outweigh the benefits in those cases. However, if you have any concerns, we're more than happy to call and chat about it.
Are there any risks associated with spaying and neutering?
The main risks associated with spaying and neutering are related to the anesthesia itself. And so those risks mostly have to do with blood loss and low blood pressure. The good news is that at Forest Grove Vet, we're aware of those. We have really intense monitoring throughout the procedure to watch for those and to catch them. And so we minimize that risk as much as we can. In general, for a young, otherwise healthy patient, the risk is quite minimal.
How should I prepare my dog for spaying and neutering procedure?
To prepare your dog, we will give you a detailed list of things to do before you come in. But in general, you're going to want to ensure that your dog is not eating after midnight unless we're telling you otherwise. Your dog is allowed to drink water. And other ways to prepare your dog would be, we're going to send home some medication ahead of time with some pain medication, some anti-stress, and some anti-nausea medication. And so you can prepare your dog by giving them those medications as prescribed.
What should I expect on the day of surgery?
On the day of surgery, you can probably expect to wake up a little bit early to be able to give your dog the medications that they need to come in. once you have your dog here, you can expect one of our team members to do an intake. So they're going to ask you a couple questions about when your dog last ate, any concerns that you have. They're going to confirm what it is that you want done during the anesthesia. And then we'll borrow your dog for the day. And so they'll come back with us. We'll have a cozy kennel set up with them. We typically don't reach out to you unless there are any concerns or questions that we have on our end until after their surgery is completed. And so you can expect a text or a phone call, depending on your preference, letting you know that your pet is out of surgery, and a pickup time where we'll go over all of the instructions of how to care for them afterwards.
How long does spaying and neutering procedure take?
So the procedure itself actually encompasses a lot of things. And so I would say for a neuter, we're looking at about an hour. And for a spay, we're looking at about an hour and a half. Now, that's not time that we're actually spent in surgery, but it's time that we spend prepping your pet. So we have to place an IV catheter. We have to place a breathing tube down their throat. We have to shave and clean the area that we're going to be doing the surgery on. We have to perform the surgery itself. And then we have to make sure that they wake up from anesthesia and are fairly alert before we move on to the next patient. And so that, varying on patient size, can take anywhere from an hour and a half for each dog. But like I said, this really does vary. The actual time that we spend in surgery with your pet, of scalpel to skin, doing the procedure, for dog neuters, we're probably talking in the realm of about 10 minutes. And for dog spays, again, depending on the size of the dog, somewhere in the realm of 15 to 30 minutes to do that.
What is the recovery process like for my dog?
The recovery process tends to take about 10 to 14 days for that skin and muscle to really heal and get close to normal again. Some things that you can expect in the first 24 to 48 hours would be your dog might be a little bit groggy, might be a little bit sleepy, maybe a little bit less interested in food, not always. But in general, after that first 24 to 48 hours after the surgery, your dog tends to be feeling pretty good. We got good pain control on board for them, and so they tend to want to return to their normal life. It's actually harder for you to help keep them calm.
How can I care for my dog after the surgery?
Some things that you can do to help care for your dog would be: one, make sure that you're giving the medications that we prescribed, be it for pain or to help them relax. The second thing that you can do would be keep an eye on their incision. You don't have to touch it or do anything like that. You can just look at it and see, is it red? Is it oozing? The third thing that you can do is monitor your pet's behavior. So your dog should be fairly back to normal within about 24 to 48 hours. And so if they're still just not themselves, they're not wanting to eat, they don't want to be cuddled or pet, and normally they do, those would all be reasons to give us a call.
Will spaying or neutering affect my dog's behavior?
In general, spaying and neutering will not affect your dog's behavior, especially in little puppies. They tend to maintain their vibrant, bouncy attitudes. In times where it might change your pet's behavior would be if you have an older dog with known behavior concerns. So they are aggressive, they might be peeing throughout the house. In those cases, sometimes spaying or neutering can make a big difference to stop those behaviors, but this is never guaranteed.
Can my dog still go into heat after being spayed?
So your dog should not be able to go into heat after being spayed, because during a spay, we remove her full ovaries. Those are the organs that are making hormones. However, there are rare complications of the surgery where a small piece of ovarian tissue might be left behind. Normally, this tissue will die off on its own, but sometimes it can find a blood supply, and that little tiny piece of ovary can go on to produce hormones and make what looks like a heat cycle. And some dogs are really unlucky and they make their own ovarian tissue somewhere else in their body. Think kind of similar to females with endometriosis. And so it's really important, if your dog has been spayed and you feel like that she's coming into heat again, that you let us know.
Can a pregnant dog be spayed?
A pregnant dog can be spayed.
Will spaying or neutering make my dog gain weight?
That's a really great question. And so Although spaying or neutering itself won't force your dog to gain weight, we find that it often does is that it can slow your dog's metabolism. And so if they're eating the same amount of food that they were eating before they got spayed or neutered, or they just have free access to food, that they absolutely can put on more weight after their surgery.
Are there any long-term health issues I should monitor after spaying and neutering?
There are no long-term health issues that we have you specifically watch for after a spay or neuter. If you ever think that there is something wrong with your pet or that you are concerned about them, please call us. We're more than happy to help. And we definitely want to hear from you if you think that your pet is not okay.
How much does spaying and neutering typically cost?
Spaying and neutering has a huge variance in cost, mostly depending on the size of your dog. And also if you're wanting to get your pet microchipped or have blood work done while they're under anesthesia. And so because of this huge range, if you want to have an estimate made up, we're more than happy to do that. You can just give us a call.
What should I do if my dog has complications after surgery?
If your dog has complications after surgery, we want to hear from you right away. After your dog has surgery, we will send you home with a list of things to watch for and things that we want you to call us for if you notice them in your dog. And so if you see any of those, let us know. But honestly, if you have any worries, please call us. We might just have you take a picture and send it in, but we might be wanting you to bring in your dog so that we can actually see them in clinic. If you have any questions that we didn't answer here and you're still curious about, please give us a call at Forest Grove Vet Clinic. We're always here to help.